Hi, my name is Srikanth Gollamudi. I am a consultant orthopedic surgeon specializing in shoulder and knee surgery at the Krishna Institute of Medical Sciences, Secunderabad. Today I am going to speak to you on frozen shoulder. People may be aware of this problem, but for those who wonder what frozen shoulder is all about, shoulder pain is increasingly a problem of the middle age, starting somewhere around the 4th decade of one's life, and if neglected can progress on to a condition called frozen shoulder. We really do not know what causes frozen shoulder, and hence the causes could be many, especially the people who have diabetes with very poor control of their metabolic condition should be especially very careful, as they seem to be increasingly prone to this particular problem. Now, shoulder pain can start very innocuously, and it might sound as if it is a minor irritant, but I would suggest that people do not ignore it. And when it progresses to a state where you are not able to sleep on the side that it is painful, and you are not able to do any overhead activity or feel any sort of discomfort when you move the shoulder above your shoulder level, then you should be concerned and seek orthopedic consultation immediately. Failing which, this progression of this problem can increasingly restrict someone to stop using their shoulder in its fullest possible function, and hence restrict to activities below the shoulder level, which progressively progresses to a condition which is frozen shoulder. In this condition, when you have a full-blown stage of frozen shoulder where the pain is quite severe and the movement of the shoulder is very significantly restricted, even simple activities like wearing clothes or taking off clothes becomes a problem. Now, at this stage you really need to seek medical attention, and most of the time when you have this stage of freezing, that means it's evolving into a complete frozen shoulder, you need significant amounts of painkillers to manage the significant amount of pain that you have, which restricts the movement. Furthermore, in addition to pain management, you also need physiotherapy, that is range of motion exercises, to improve your shoulder mobility. Now, this is a very long drawn out process with pain management, and hence it's not a very pleasant experience to those who have frozen shoulder. Now, the good news is that 70% of most of the people who end up with a stiff shoulder tend to improve in time with just pain management and physiotherapy. But for the unfortunate 30%, you may even require surgical treatment to make the shoulder mobile again. So my advice is to people to recognize symptoms of shoulder pain and restriction of movement early on and seek medical treatment, and this form of treatment could be even surgical to avoid a much more painful process at a later stage. A stitch in time saves 9. Thank you for listening.